So we heard there about the diagnostic procedure, the colonoscopy, and you were called back to the clinic for the results. You told me there was about another 2 weeks.
To the best of my knowledge, yes.
When you came back. So what did they tell you when you came into that critical meeting?
I was accompanied by my wife, which was good, I think. I was told basically that the biopsy had proved cancerous. That sort of resonated with me for a bit, but he did say that it was not very far in the rectum, that it was treatable and possibly curable. But obviously he didn't assure me of that. But he then explained that it would be a fairly long road, that his part in the cure, or in the treatment, is as a surgeon to remove the tumour. But prior to that, there'd be sort of shared care between himself and an oncologist, who I believe is the job title of a Mr.
Osman, is it?
Osman, Mr.
Yes.
Osman.
Yeah.
So I then quite quickly was sent to see Dr. Osman, which was at the LRI, as opposed to the Leicester General, which is where I had my dealings with Mr. Thomas.
Yes. So if I can understand correctly, they wanted to start some chemotherapy prior to the surgery to shrink the tumour a little bit.
Yeah, it was explained that be considerably prior to that. But he said the surgery will be a long way down the road. So let us concentrate on the first parts.
Okay.
So I went to see Dr. Osman, and he told me that the time was of the essence to start radiotherapy in tandem with chemotherapy pretty promptly.
I see.
So I had an appointment which was basically just to measure me up and mark the target area for the daily radiotherapy, presumably so they didn't waste time and were as accurate as they could possibly be each time. That went on for 5 days a week for 5 weeks, the exception being the weekends.
Yes.
But even bank holidays were not accepted, and I did go in on bank holidays. I was taking oral tablets at the same time. They were prescribed at the LRI, and each time they were prescribed, there was a sort of a check on how they were affecting me, and there was cycles. It was always 3 weeks of taking them and a week of not taking them, and on the Thursday of that week I would attend my GP for a blood test, which was the results then were in the possession of the clinic supervisor, although I didn't always see Dr. Osman, just to make sure it was safe and appropriate to give me the next course, which they did every time with the exception of one. I did have a swelling of the feet, which is one of the common side effects, and they decided to give me an extra week for that to subside, and gave me some cream, which did help greatly, and I applied that daily, and thereafter it went on till I completed the course.
How difficult overall was it to tolerate the radiotherapy and or the chemotherapy?
Well, the radiotherapy was a kind of non-event insofar as I just positioned myself. They lined up, they went out of the room, but assured me that I could attract their attention in any form of distress. And the whole procedure was probably barely 5 minutes, and was painless, and I was just unaware of what was going on. There could have been nothing going on as far as I was concerned, but clearly there was.
It was straightforward.
Yeah.
And the chemotherapy?
The chemotherapy, it was a question of discipline to get in the habit. I had to do it twice a day, and there was 4 different tablets each time. I think it was because I understand that each dose is designed for you personally, I suppose, relevant to your body mass and everything else, or what they're trying to achieve as well. I don't know. But provided you remembered to do them, and it was always at least 8 hours apart. Now, it was stressed to me that that was pretty important. So fairly obviously I would have one at breakfast time and one with my evening meal, wherever the situation allowed, which it did 9 times out of 10. But I was conscious of, very least, of having a minimum of 8 hours. If it was 10 hours, I don't think that was an issue, but fairly obviously you couldn't just get them down your neck and be done with it. You had to give them the chance to work as I was told they should.
Yeah. So were you attending for that on the chemotherapy suite?
Yes, you sat in the chemotherapy suite and went into the room where people were having it intravenously. So it was in a waiting room with a lot of other people, and I spent some time in the waiting room because they're busy people, I understand.